40. Okay, that is the third condition. So first condition, repulsion. Second condition, suppression. Third condition, the complex disease. Or the new disease, after having long acted on the organism, at length joins the old one that is dissimilar to it. Okay, so now the new disease which entered into the body, and also after long action on the body, it just joined with the old one which is already occupied. Okay, and forms with it a complex disease. So both the new disease and the old disease form a complex disease, so that each of them occupies a particular locality in the organism, namely the organs peculiarly adapted to it. Yes, each disease condition occupies the organs which are peculiarly adapted to it, and as it were, only the place specially belonging to it, whilst it leaves the rest to the other disease that is dissimilar to it. Okay, so here what Hahnemann mentioned, no, now the new disease and the older disease, they just forms a complex disease. Complex disease means this new disease not produce a single disease. This new two diseases are not produce a single disease. Each disease occupies a particular part which are peculiarly adapted to it. Okay, so they form the complex disease and leaves the other part to the other disease that is dissimilar to it. Okay, for example, if one disease affects the lung and another disease when they enter into it affects the liver, now the both are affects that lung and liver separately and leave the brain to the other dissimilar disease. Clear? Thus, a syphilitic patient may become soric and vice versa. Yeah, now a syphilitic patient, now when he affects the sora, both the conditions are manifested as two diseases dissimilar to each other. They cannot remove, cannot cure one another, because these two disease conditions are dissimilar to each other. So definitely the cure won't take place. At first, the venereal symptoms are kept in abeyance. Abeyance means a temporary pause and suspended when the soric eruption begins to appear. Okay, because you know the venereal symptom is the symptom of the syphilitic miasm. Okay, so first the patient having the venereal symptoms, now these are kept in abeyance and suspended when the soric eruption begins to appear. The venereal symptom is the weaker one, now the soric eruption is stronger one, so the venereal symptom is temporarily suspended. In course of time, however, the two join together. Okay, the two join together. Two means soric and syphilitic. That is, each involves those parts of the organism only which are most adapted for it, and the patient is thereby rendered more diseased and more difficult to cure. So you already know that the sphere of action of the syphilitic, sphere of action of the soric, both are different. So both are occupies the part. For example, you already know that syphilitic miasm mostly it affects the bones. The soric miasm is also affect the functionals. Okay, so here the disease condition takes place in separately by these two dissimilar diseases. When two dissimilar acute infectious diseases meet, this is another example. So first example, syphilitic condition with soric. Second example, when two dissimilar acute infectious disease meet, as for example, smallpox and measles. The one usually suspends the other, as has been before observed, because we already see that one. Either smallpox is there or measles there. So only one condition is manifested externally and another condition is suppressed. Yet there have also been severe epidemics of this kind, where in rare cases two dissimilar acute diseases occurred simultaneously in one and the same body and for short time combined as it were with each other. Okay, so in some situations these two dissimilar acute diseases, the smallpox and measles, They occur simultaneously. It is a very rare occasion, but it is also there because they are both are dissimilar in nature, so they can't able to cure one another. So during an epidemic in which smallpox and measles were prevalent at the same time among 300 cases. Okay, so in one epidemic, Honeyman has given one example, one epidemic, that is a two disease condition. Smallpox and measles were prevalent at the one time. There was yet, so totally 300 people, among 300 cases, there was yet one single case in which P. Russell met with both these dissimilar diseases in one person at the same time. Okay, so he just saw that P. Russell saw that these two epidemic diseases, smallpox and measles, were prevalent in one person. Okay, both the conditions present. Rainey witnessed the simultaneous occurrence of smallpox and measles in two girls. He also observed that. J. Morris, in his whole practice, only observed two such cases. Similar cases are to be found in Miller's works and in the writings of a few others. So in all the four examples, okay, all the four authors, we can say they just saw the smallpox and measles combined and present in one individual. Okay, then Jenker saw cowpox run its regular course along with the measles and along with purpura. So third conditions are also there. So he observed the Zenker saw cowpox and measles and purpura in affect a single patients. The cowpox went on its course undisturbed during a mercurial treatment of syphilis, as Jenner saw. So when they treated that cowpox by that mercurial medicine, okay, for syphilis, the cowpox went. Okay, so here these are the some of the what is called natural dissimilar disease examples for the complex diseases. Okay, clear? 41 aphorism. Much more frequent than the natural disease associating with and complicating one another in the same body or the morbid complications which the inappropriate medical treatment, that is the allopathic method, is apt to produce by the long continued employment of unsuitable drugs. Okay, so here when you compare with the natural dissimilar disease example, here more examples are there. For what? That more examples in the allopathic examples, because in allopathy most all of the disease condition, because the patient is suffering from the disease condition, when we take the medicine for the long time, now the patient is having two diseases, that is the natural disease condition as well as the medicinal disease. It is very common. Okay, to the natural disease which it is proposed to cure, there are then added by the constant repetition of the unsuitable medicinal agent. Okay, actually for the curing purpose only we prescribe the medicine, but what happened when you prescribe the allopathic medicine? So due to the unsuitable medicinal agent and the constant repetition, it produces disease condition. What kind of disease condition? The new, often very tedious, severe, okay, very tedious, morbid conditions corresponding to the nature of this agent. Okay, corresponding to the nature of this agent means this medicine condition. Those gradually coalesce. Coalesce means add together different elements, coalesce with and complicate the chronic malady which is dissimilar to them. Okay, now this medicinal condition itself is also produce a disease condition, adding to the old disease a new dissimilar artificial malady of a chronic nature, and thus give the patient a double in the place of a single disease. Previously, that person is having only that natural dissimilar disease. Now he is also having that artificial disease condition due to that medicine, allopathic medicine. That is to say, render him much worse and more difficult to cure, often quite incurable. So by this prescription of that medicine, Now the disease condition is complicated and often quite not incurable. It is not possible to cure. Many of the cases for which advice is asked in medical journals, as also the records of other cases in medical writings, attest the truth of this. Even the medical journal also, Hanuman also saw that thing. Even the journal also they mentioned that of a similar character are the frequent cases in which the venereal Chancres disease, complicated especially with SORA or with the dyscrasia of Condylarthria gonorrhea. So it is a common one. Animal put one example. The venereal condition is may complicate the SORA or it may complicate the psychosis. Is not cured by long continued or frequently repeated treatment with large doses of unsuitable mercurial preparations. Okay, so that condition is venereal chancre. Syphilitic condition, mostly they use the mercurial preparation. Now, this mercurial repetition of the unsuitable mercurial preparations, but assumes its place in the organism beside the chronic mercurial affection that has been in the meantime gradually developed. Okay, what happened? No, that syphilitic condition may complicated with the soric or psychotic when that person is taking that mercurial combination. Now, along with the disease condition of that syphilitic, that medicine is itself produce its own symptoms, and thus, along with it, often forms a hideous monster of complicated disease. What is the hideous means? It is a grossly offensive to mortality. Hideous means it is a very much ugly monster. What is a monster? Because one time Hanuman when explained about the Sorik, it is a monster. The same thing. What is a monster? It is an imaginary creatures. You see in some film, one person is complicated. Sorry, it is a combined form of the animals as well as the man, like that. Okay, so monster of complicated disease. Within bracket, what is a monster? Under the general name of masked venereal disease. Okay. So, this is also a complicated venereal disease, which then, when not quite incurable, can only be transformed into health with the greatest difficulty. Definitely, the cure won't take place, only the complications takes place by this condition. Okay, so this is a very important aphorism about that complex disease. 42 aphorism. 42. Nature herself permits, as has been stated, in some cases, the simultaneous occurrence of two natural diseases in one and the same body. Okay, so nature itself also permits these two dissimilar diseases at a time in the body. This complication, however, it must be remarked, happens only in the case of two dissimilar diseases, which according to the eternal laws of nature do not remove, do not annihilate, and cannot cure one another. Okay, so when two dissimilar diseases meet together, definitely they do not remove one another, do not annihilate one another, and also cannot cure one another. But as it seems, both, sometime or all three, remain as it were separate in the organism, and each take possession of the parts and systems peculiarly appropriate to it. Okay, so here what happened? No, each disease condition peculiarly affect the part which are adopted for that one. Okay, so peculiarly appropriate to it, which on account of the want of resemblance of these melodies to each other. What is the want? Here the meaning is the lack of resemblance of these melodies to each other, because these two dissimilar diseases are varying in character. Okay, can very well happen without disfragment to the unity of life. So it is usually happen. Okay, it is not possible to give the cure. Disparagment means not important or valuable. So by this meeting of the two dissimilar diseases of the various kinds, definitely these two conditions are not helpful in the unity of life. Clear?
வழியினிலே நன்மை தீமைக்கு இடையினிலே விளையும் போரினில் சத்தியம் வென்றிடுமா சக்தியையும் பக்தியையும்